Our co-facilitators, Aaliyah Nixon and Aisha Muhammad, are going to be facilitating the talk. So first, our introducer again, Ferris Omar, will go, and then we'll hear a bit from Anna Meyer about her story. So Ferris, whenever you're ready.
All right. Hi, I'm Ferris, and I'm going to be introducing Anna Meyer. Anna Meyer is a nurse director of emergency nursing at Brigham and Women's Hospital in Boston, Massachusetts. She has worked her entire career as an emergency department nurse for the last 6 of those as a nurse leader. She is from Texas, and in high school, her family relocated to Connecticut. She completed her Bachelor of Science in Nursing in 2003. She began her career as an emergency department nurse at Hartford Hospital in Hartford, Connecticut. Anna earned her Master's of Science in Nursing, MSN, in 2009 from the University of Hartford in West Hartford, Connecticut. In 2010, she left Connecticut and began working as a nurse manager at South Shore Hospital in Weymouth, Massachusetts. In 2014, she began her career at Birmingham and Women's Hospital in the emergency department as an operations flow manager / assistant nurse director. She completed her doctorate of nursing practice, DNP, in December 2017, and in the same month became the nurse director of the emergency department. Anna is currently enrolled at Framingham State University towards her master's business administration. During her free time, Anna enjoys spending time with her family in Texas. And when we are able to safely travel again, her first trip will be to Texas to see her family, which includes the 2 greatest joys of her nieces, Lena and Mayviv. She also enjoys reading, yoga, and hiking. Anna.
Thank you, Ferris. That was great. Nice job. You did a great job on that. I know it's not easy to do that, so thank you very much. Thank you to all of you that have joined us today. It sounds like I'm going to have some questions, which will be great. So first, I know that this is an exciting time, and healthcare is definitely a profession right now that is it's always needed, right? But it's needed now more than ever. So this is really a great opportunity, I think, for me to talk about my career and how I got to where I am, and then I'm happy to answer any questions. So Ferris did a great job introducing me. I am from Texas originally. My family is all there, so it's been a challenging year to not see them. But I know that the work that I'm doing as a nurse leader is very important, and this work will continue, and eventually we're going to come out on the other side of all of this. So I started my career, and I should say that what I wanted to be a nurse. I knew that I wanted to be a nurse. And I took a couple different, thought I was going to go down a couple different pathways, and never thought that leadership was the path that I was going to choose. But I had a great mentor that led me in this direction, and I am eternally grateful to him. So when I was a junior in high school, I became involved in a program that was available in my town, and I became an EMT, an emergency medical technician. And I worked as an EMT up until about 2010 when I moved out to Massachusetts. So I worked as a nurse and as an EMT. So pre-hospital medicine is where I started. I enjoyed it a lot. And then, so even when I was in college, that was my job. I had to work. So that was the job that I did that helped put me through school, both my bachelor's and my master's. So I did a traditional Bachelor of Nursing, so a BSN. It was 4 years. Went to St. Joseph College, which is now the University of St. Joseph in Connecticut. And you know, it was challenging, but obviously very rewarding. And I knew that emergency nursing is what I wanted to do. I will be very honest, there were long days, long nights, but I have been afforded a career that that has allowed me to do many great things. And I think the greatest piece about nursing is that it's very versatile, right? You know, I could decide tomorrow that emergency nursing is not what I wanted, and maybe I wanted to go and uh, you know, take care of babies, or you know, pediatrics, or patients that are you know, that have cancer, do oncology. So there's so many different avenues, public health. So there's many different avenues for nursing. I chose emergency nursing. I worked at a level 1 trauma center in Hartford, and saw a lot and learned a lot. And then, like I said, my mentor asked me if I was interested in taking on a permanent charge nurse position. I did that, and that's when I decided to go back to school. I focused on administration, leadership, earned my master's. And then shortly after I earned my master's degree, I applied for a job out at South Shore Hospital in Weymouth. And that is how I ended up out in this area. Never thought I would come to Massachusetts, but the plan was to always go back to Texas, but I am here. And you know, it was a great learning experience. It was a smaller, you know, South Shore was a smaller hospital than what I was used to, but still a great learning experience. And then I went to Brigham and Women's in Boston, and that gave me the opportunity to go back to school and earn my doctorate. And so right when I finished my doctorate, I did take the nurse director position. So, you know, when we think about careers that there's opportunities for advanced degrees, and all of this, I was still able to work and go to school, which for most people is really important. So I think that that's one of the greatest pieces about healthcare and about nursing, is that you know, I could advance my career, but I still needed to work in order to live. So I was able to do all of that. It's not there are, and then, like I said, there's many different avenues to take, and I think that that's really important to think about in nursing and in the healthcare field, right? There's a lot of different ways in which you can help people or be involved in healthcare, not just nursing. So anyway, that is kind of my background. I think I told Tony and Greg and Mr. Banks when I logged on that I'm in the process of moving. So I do apologize. I wanted to show you pictures. Believe it or not, I was once your age. It seems like a really long time ago, but I was. I promise. So I think that it's just it kind of gives you insight as to I guess how far I've come, and I'm going to be very honest. I am not I'm not someone who school was often challenging for me, and I mean that in a way that I felt sometimes that I had to study more than most people, and there were those challenges in itself. It can be tough, right? When you're trying to balance work plus going to school full time, and then, you know, really having to double down and study more than sometimes what it felt like your peers were doing. But I made it. And I think that, you know, I should say if I can do it, I know that anybody can do it. It just takes hard work and perseverance. And sometimes there were some sleepless nights, but it's all worth it. It's all very much worth it. How'd I do?
That was great. That was great. I wrote down about 5 questions, but I know I'm further down in line. I'm not the person who gets to ask most of the questions today. So let's see. All right, so again, I want to direct my students to Google Classroom. If you haven't gotten there if you haven't gotten there already.
That was amazing.
At least that got recorded, huh? My students, go on to Google Classroom if you haven't already. You'll see the link to the questions that you guys wrote. And so Aaliyah and Aisha are going to co-facilitate our question session. And so how this is going to work is students are going to ask the questions that they wrote ahead of time. And Aisha and Aaliyah, you guys together are going to kind of call on people to ask questions. So maybe we can start with Aaliyah. You can kind of talk to the first person, and Aisha, you can do the even numbers, and maybe Aaliyah, you can do the odd numbers, and we'll go through it that way. All right, so why don't you guys take it away?
Good afternoon, Nurse Meyer.
You can call me Anna. Thank you.
Okay, Anna. Good afternoon, Anna. Thank you for your time. So the first question will be asked by Nailani.
Okay, so what do you like most about your job?
Hi, Nailani. Thank you. What I like most about my job, I think, that's a great question. Some days it differs, but the role I'm in now is the best part about this is I'm responsible for the operations of a department, meaning I am responsible, right, for how patients flow through our department, problem solving, and all while keeping the patient in the center, right? That is the very reason you go to work every day. So the best part about my job, I would say, is being a part of how do we continue to treat patients the best way that we can, and that's the best part of my job.
Hi, Anna.
Hi.
So the next question is going to be asked by Alessia.
Okay.
Hi, Anna. So my question is, what's the average salary, yearly, monthly, daily, or hourly?
That's a good question. I should have.
You knew they were going to ask that.
I did. So it depends on where you are working, right? On average, nurses will start somewhere around I think right now I can tell you we're starting, and I'm only speaking for one hospital. So on average, you can expect to start somewhere in the mid 20, high 20 range as a starting point for hourly. And then that's that. And so, yeah, that's the best answer I can give for a salary range. So that's where you can anticipate to start. So that would put you somewhere in 60s for a yearly salary. So that's the best answer I can give for that one, just based on current hiring and data.
Joshua, can you ask this next question, please?
What is the monthly shifts?
So that's a great part about nursing. That's a good question. So nursing is it's a 24/7 operation for emergency nursing. Some types of nursing do not require you to work Monday through Friday. So I have nurses that work 3 days a week, 2 days a week. Some of them work 4 days a week. And, part of that is working nights, weekends, holidays, some of that. So it's a big commitment to miss, weekends and holidays with your family. So, but the majority of nurses now, if you're working in an inpatient hospital setting or an acute care setting, most nurses are working 3 12-hour shifts.
The next question is going to be asked by Claudia. The next question is going to be asked by Claudia. Is she here?
It looks like she's here, but her audio might not be working. So she may need
If she can't speak, then Julius can take the question.
Okay, it doesn't look like either of them are here, so I'll read
Okay.
the question.
Okay. Thank you.
So how is it like, what is it like working during COVID?
That is a great question. I think this has been one of the most challenging years. Not one of. This has been the most challenging year in my career. And when you think about a leader and you and the role that I have, right? My role is to be all-knowing, right? So policies and procedures are changing daily. The information, the science that we have, the evidence that we have changes. The recommendations, right, from our infectious disease department and infection control changes, and that has been the hardest part, right? Everything is different every day. Something changes, and it's making sure that my staff come in, that they have the protective equipment that they need to keep themselves safe, keep their family safe when they go home. It's been supporting staff and patients and families that are not able to be with their loved ones because we don't have visitors right now. So it's been supporting them. helping people understand. And but really, all of that is it's challenging. It's so hard to think about the support that you need to give to an entire group of people, and they are relying on me, right, to be that support, to be strong, to keep them safe, to keep them informed. And that has been one of the biggest challenges during this whole time, is being that person for my staff. I wouldn't trade it for the world. I wouldn't, but it has been one of the most challenging parts.
So my question is, how do we get into a nursing program, and is it like hard to get into?
So yes, that's a two-part question, and in that, when you are thinking about going to nursing school, one, you need to select, if nursing is you're sure that that's what you want to do. You need to find a school, whether you choose a 4-year degree or a 2-year degree, an associate's degree. You have to choose, obviously, a school that has nursing. And then once you are in school, you're accepted into, a nursing track, and you start taking prerequisites towards nursing. Then the school I went to, we were accepted the end of our sophomore year, so that the second semester of sophomore year. So you applied during the fall semester of sophomore year. And so that part, you had to have a certain GPA, you had to have certain classes done. And then, it was almost like applying to college all over again. There was an application process for it, but that the best advice I would give is that if you're sure that nursing is what you want to do, I would choose a school that has an accredited nursing program. And then you need to look at what classes are offered that freshman year to ensure that you meet all the requirements to apply either your sophomore year for the second semester sophomore year, or second semester. A lot of colleges will then accept you in junior year.
Okay, I have another 2-part question. So this question is, what college did you go to? And also, if you would have to say what would be the best school to study nursing, what school would you say?
So I went to St. Joseph College, which is now the University of St. Joseph in West Hartford, Connecticut. I guess that's one of the schools that I went to. So I've gone to 3, but all for different degrees. So they had a great program, and that was not my first choice to go to University of St. Joseph. My first choice was to go to school in Texas, and then my second choice was University of Connecticut. And the financial aid package that I was given through University of St. Joseph is why I chose to go there. So that is something that start saving your money now. that's some of my best advice. Start saving. It comes a lot, but I think the best school is sometimes comes down to what you can afford and what they're willing to do to help you out to get through those 4 years, because you're going to work really hard. You need to come out to be able to afford to live, and everybody, I don't know anybody that doesn't have college loans. So think about that when you're applying. Some of those great schools come with a really big price tag.
So the next question, Alessia, can you ask the next question?
Is there anything you wish to have done differently on your journey to becoming a head nurse?
You know, I thought about this the other day. That's funny that you asked this. I was thinking about this, doing some reflection. For me, I wouldn't change anything that I've done. All of the experiences in life have brought me to where I am. They have afforded me, you know, these different opportunities and learning experiences. So I would say I don't think I would do anything differently. I feel that in life it's really important to learn from all of our challenges as well as opportunities, and so I wouldn't change anything.
The next question is going to be asked by Alexa.
Okay.
What is something you would recommend to students interested in the same career path?
I would say a couple things. One, make sure that your grades are really solid right now, and learn as much as you can about what interests you. The other piece is that I think this opportunity that you have right now is great, and take advantage of everything that is offered to you and what you can learn. And the other piece is that when you get into nursing school, if you are going down that pathway, or that's the path you want to choose or would like to choose, any career, this is any solid career advice. Don't let anybody tell you that you can't do something. That is my number one advice to anybody. If you work hard enough and you want something, that is that truly is, I think, work hard. If you work hard and make great decisions, then you'll get there. And I think that goes back to the previous question about what I would do differently. And I think the one thing I would have done differently is I would not have listened to, I had one person in particular that told me I was never going to make it as a nurse. And I would never let them, if I could do things differently, I would go back and I would make sure that person knows that I'm a nurse leader now. But two, the second piece of that is that I would have never let this person rent space in my head. And sometimes that was a good thing that somebody told me that, because I fought even harder to get to where I am. But the second piece is that don't let anybody ever tell you that you're not good enough to do something or that you can't do something, because that is absolutely not true.
Before I ask my question, Famara, would you like to go first?
Yeah, thank you. Oh, good afternoon. Okay, so you said we're gonna have okay, my bad. Do you think to avoid paying loans or whatever? Do you think it'd be smarter to go to community college for 2 years then transfer?
So that's a great question, and I work with a lot of nurses that have done that. So if you there's a couple of people that have done that do the mentoring program, and I know that we have definitely talked about this, and that is something that that is entirely up to you, and there's opportunities and when you do that, and there's advantages to doing that. One of them is that doing a 2-year program, right? You come out, you sit for the boards, and you're able to get a job sooner, which means that you're able to start making money a lot sooner. And then there are places that will help you go back to school to get a bachelor's degree. So I think that if that's what you in life, if that's what you have to do, that's a great opportunity. It's a great opportunity to come out and, start working and join the workforce. And I would say that as long as you're committed to going back to school for your bachelor's, then if that's the pathway that works best for you, then that's what you should do. The only reason I say that for nursing is that a lot of hospitals now require you to have a baccalaureate degree or to have entered into a program. So Brigham, where I'm currently at, requires you to have a bachelor's degree for nursing. We still hire. No matter what degree you have doesn't determine how good of a nurse you are. Please don't. I will say that too. But a lot of hospitals now are moving towards hiring nurses that have a bachelor's degree in the acute care setting. So it depends on what you want to do, but as long as you're committed and if you want to be in acute care and that's the way you start, that's definitely a pathway. If that works for you, then that's what you should do.
Thank you. And another question is, have you ever thought about quitting?
Yeah. Yes, I have. That's a great question. I thought there are some days that are really hard. There are some days that just rock you to your core. You have those patients that you'll never forget. You have those really tough traumas that you never forget, or sad cases. And there are some days where you just aren't sure that this was the right choice. And yeah, I have thought about it, but honestly, when I think about it, I don't know what else I would do. So I guess quitting's not an option because I don't know. There's nothing else that interests me. And the great part about nursing too is that, like I said before, there's so many different avenues to go down. So if you feel, that you're burnt out in one aspect, but you don't want to leave nursing, there's so many different avenues to go down that when you feel like you're done in one place, it's okay to go to another.
How did you become a head nurse, and is it different from being a regular nurse?
Say the first part of your question, sorry.
How did you become a head nurse?
Oh, okay, got it. So the difference is I am, so as a nurse director, I have a staff that report to me, right? So I am responsible for all of the emergency department nurses, the nursing assistants, we call them ESAs, so the ESAs and business specialists. So I have a staff of 246 people. And the way that I started down the leadership track was a mentor of mine, and who saw potential in me and asked me to take a position when I was at Hartford Hospital, and that's how I started. At Brigham, it was the same thing. My now associate chief nurse, same thing, saw potential in me. This was not the plan to stay here. I thought, okay, when I finish my doctorate, I'm going to move back to Texas with my family. That's where I'm going. and this position came up, and it's something that, you know, I keep saying I'm going back, but healthcare is great here. There's a really, I'm sorry, my neighbors upstairs are, I don't know what they're doing, so I apologize. But the healthcare up here is like none other. And so I applied and became, so to get back to that question too, how this role was really hard work. I knew that this is something that I wanted, and I became involved in projects. So anything that came up, so committee work, project work that needed to be done, that's all of what I became involved in, and that's really how I moved up.
Can Alicia ask the next question?
My next question is, how do you take care of yourself with such a demanding job?
That is the $1 million question that you've just asked. I don't do a great job of that. I don't have a great work-life balance. So don't go down that pathway. The way that I do take care of myself, though, especially now, is I was an avid runner years ago, and I actually had a really bad injury a couple years ago that required surgery. And so that piece about now, like hiking and walking and taking opportunities, yoga is a big part of my life. Meditation is another big part. That is something that's how I take care of myself now, because if you don't, everything that's going on in the world will be all consuming of you, and that's not fair to you or to your family. So I make sure that I just take a couple moments for myself every day.
Can Josh answer the next question?
Have you ever felt like you wanted to switch your profession, or did you ever give up either because the profession was too hard or demanding?
No, I didn't want to switch my profession. It is hard. A lot. Every day is hard. But no, I don't think I've ever felt that I would that I needed to switch my profession. That's not true. There are some days I just don't know what else I would do. I mean, you know, the other day when I got coffee at Starbucks, I thought maybe it would be easier to go to work there, but no, I would never leave nursing.
Okay, so it seems like mentors played a big role in your life and your career. So what advice do you have around finding mentors and working with them?
They have played a huge part in my life. One in particular that I've spoken about quite a bit, Jonathan, and unfortunately, you know, he passed away last year, and that was really hard because he was the person I felt like, other than my parents and, you know, your family and friends that believe in you, having a supportive mentor. I think there's two different types of mentors. I have a career mentor, which he was, and then you have mentors that you just kind of organically find. And he was a career mentor, and those are very hard to come by. And I would say that when you have someone that you feel like is a good mentor for you and is a good fit, it's okay to ask somebody, I really, to say to them, I admire you. I like, maybe for you, if it's a teacher or somebody in healthcare, somebody, and to say to them, I really like the career path that you've taken. I'm looking for a mentor. Can we have a conversation? Can we talk about, I'm looking for a mentor and see if that works for you. And that's for my first mentor. Our kind of mentor-mentee relationship just happened organically and formed because of the role the potential, I guess, that he saw in me. The mentor that I have now is, I have a couple. One of them is my boss, and we have those conversations that, a boss may need to have with their direct report or with an employee. And then we have conversations where things come up and I'm not quite sure how to handle them. And I go to her and say, can you help mentor me through this and help guide me through this, not as my boss, but as a mentor and as somebody that I trust and look up to. So I think as far as mentors, it's okay to ask somebody to be your mentor.
Okay, the next question is, why do you think being a nurse is important?
So I think nurses are important, and because, let's see if Tony's still on here. So the nurses are they spend the most time at the bedside, and we work as a team with a lot of different disciplines, mainly our physician colleagues, our physician assistant colleagues. But the most important part about nursing is the bond and the relationship that you establish with your patients. Last year and this year, actually in 2020, nurses were named the #1 trusted profession. And there's a reason for that. And I think that is because we get to know our patients differently than other disciplines get to know patients. And that's really important. And so I think that to me is why nurses are so important. We are advocates. We become social workers. We become listeners. We become like family to people. And we start to know our patients sometimes better than they know themselves. We're also, working at Brigham and our affiliation with the Dana-Farber, we often become that go-between sometimes when patients want one thing and families aren't necessarily there yet. And we're that person that's starting to have those conversations with the family so that the patient's needs are met.
So what do you think is necessary to do before your shift starts?
Great question. Eat, go to the bathroom. But before your shift starts is really those kind of bio things. But the other piece is, and it's easier said than done, is to walk in, you center yourself, you take a moment. And when I come into work, I am there to work and to let anything that's happening in the outside world that needs to let go, because it will affect you in the way that you interact with your coworkers and the way you interact with patients. So before I start each shift, before I go into work and start my day, the first thing I do is I walk in and I take a deep breath and I take it in and I let everything go that's outside of work and I walk in and start. Okay. Can I answer a question that's in the chat? Is that okay?
Yeah, that's fine.
Okay. So there was a question in the chat if people who have been in the nurse profession for the longest are allowed to have their first pick on when they will have their vacation. And the answer to that is yes and no. So if you work, so Brigham is the bedside nurses are part of a bargaining unit, meaning they're in a union. So there's a contract that I follow when I'm making a schedule, when we move people from different shifts, and vacation and holidays. So that's a big one that comes up. So for as far as vacation, and it goes by seniority, which is hours worked for us. So depending on the number of hours that you have worked and where you stand in seniority is how vacation is granted. Hopefully that helps. Great question. Immediate thoughts on the COVID vaccine and if you would be willing to take it if offered the opportunity to do so. My immediate thoughts are yes, it is. Actually, we started today. The first person to receive the vaccine at Brigham and Women's was one of my emergency medicine physician colleagues, and she did awesome. So, and I have staff that are taking it. Actually, we just started at 1:30 getting nurses and some of our nursing assistants through. It will be available to staff beginning Friday to take it. But my immediate thoughts are we have come so far in science, and there is the way in which vaccines are created is much different than the way vaccines were created years ago. So I will be taking the COVID vaccine as soon as I am able to.
I have a question.
Sure.
Are you not scared of the side effects that may come with it?
Yeah, I think that that's a great question. And I know that people are scared of side effects, but to me, the risk outweigh, or the benefits outweigh the risk, right? And that's something that you have to think about with anything that you do. But I would rather not have COVID, or if I were to get COVID, not have a severe case of COVID. I think in the beginning, what we thought was that it was only COVID if you were young and you had no comorbidities, meaning, you didn't have diabetes, high blood pressure, asthma, obesity, all of these comorbidities, that in the beginning we thought that this was something that only impacted our elderly patients, people with comorbidities. And then what we started to see, especially as the second surge has started, is that it is impacting our younger population, and there is no COVID doesn't have an age or the way that it impacts you. We have seen people that are younger, but in that 19 to 30 age range, just as sick as patients that are elderly with comorbidities. So for me, the risk of getting really sick is not worth a possible side effect of a vaccine. All right. How is studying to be a nurse similar to or different from working as a nurse? Mr. Banks, great question. So studying to be a nurse is book work, right? Science classes, anatomy, physiology, chemistry, organic chemistry, biology, and then, you know, your core nursing classes where we learn about medications and disease. And then working as a nurse is much different in that I took my book knowledge that I studied and started to apply it to practice. And that I think is that's the difference part of it. The similar part of it are those moments when you think, oh man, I learned about this in school, and something clicks that you learned about in school, and you're able to it makes sense why you learned something. So I think that's the similar part. The difference part is that clinicals could have never prepared me for what a nursing assignment would really look like.
Did your salary get increased, but like due to the pandemic?
No, actually, we healthcare has greatly been impacted by the pandemic, as everybody has, and in that time frame when we canceled all surgeries, the financially the hospital took a big hit, right? We still had to pay for staff and everybody to run the hospital, and by running, I mean that includes everybody from our colleagues in food services to environmental services, nursing, ancillary staff. So we took a financial hit when the decision was made to cancel surgeries. So it did not increase, no.
So are you low in supplies for the medical kits and everything?
Are we low on supplies?
Yeah.
Right now, we're not. In the beginning, we were, and that was one of the most stressful parts about this. And that's why, I mentioned keeping my staff safe. That was one of the most stressful parts about this was we ran out of things that we never thought that we would run out of. Masks, never thought we would run out of masks. We were running low on gowns, like gowns that we wear to protect, our scrubs from the patient contact. And then we ran completely out of, we call them purple top wipes, but there's a certain wipe that we use that we ran out of, and had to become very creative in the solutions that we were using to ensure that we still kept everything clean and the way it should be. So yeah, right now we have a good supply and we're doing okay. But that was a really scary time to live through.
Yeah.
Go ahead, Alessia.
My question is, what are your thoughts over people not wearing masks and not social distancing? So like basically taking COVID as a joke.
To them, you know what? To wear a mask, it doesn't harm you. It's simple, right? It's simple. It is simple to put a mask on and to keep yourself safe. And if you don't want to do it for yourself, do it for your neighbor, do it for your parents, do it for your loved ones. That's what I would say. It doesn't, when we're in something like this, it's not about you, and I don't mean you specific, but it's not about me, or it's not about you, or you know, Mr. Banks. It's about us as a whole, as a population, as people doing what's right for the greater good. And that's what I would say. Masks have been shown to work, and it doesn't harm you to wear a mask. As for social distancing, and I think that we've become, we all have COVID fatigue, and we are in the fight of our lives still, and social distancing, we still need to do it. And it's really hard, and I understand that, you know, coming from not seeing family that I see every 3 months. I haven't seen them in a year. And it gets lonely and it gets really hard, but it's what we need to do so that we eventually will go back to our normal lives. Because I don't think this is the new, while it's the new normal, I don't think this is what normal really is.
So I have a question in regards to the vaccine again, but is it true that if you take the vaccine, it'll allow for human genetic modifications, or like let you be genetically modified?
Yeah. So the vaccine is it attached to an RNA, not DNA. So there's the difference in them, but no, it does not allow you to be genetically modified. And to debunk the other myth too, is that we're not microchipping people either. That's I heard that one today. I was like, what? No, that's not happening.
Wait, so you said
I do apologize. We could keep Ms. Meyer busy all afternoon with questions, but we are stopping. We've already gone 5 minutes over, so I'm going to stop the questions here. So I do apologize, and take that as a compliment, Ms. Meyer. We keep you here for another hour, if we didn't. So.
Yes. First thing I want to say is that I feel like nurses don't get as much appreciation as they should. So I just want to thank you for everything you do.
Thank you.
And I want to thank, no problem. I want to thank you for being here and answering all our questions. And for us, sorry for keeping you 5 minutes past, but thank you for answering all our questions. I really appreciate that.
Of course, absolutely.
So we thank you for coming.
Thank you. It's been my pleasure, you guys. This has been a really challenging couple of weeks, and this has been the best part of those couple of weeks. So thank you.
Leah, if you want to take it away. All right, and with that, I want to thank all of the students that contributed to running this event. You guys did a fantastic job. So thank you for that. And once again, Ms. Meyer, thank you so much for your time.
You're very welcome.
And Dr. Komaroff, thank you for setting this up. This is going to be the first in a series. So be sure to join us next month when we have another guest. It will be a similar format.